Good afternoon, everyone. Thank you for being here today. I'm Steve Geller, the mayor of Broward County. As I've said many times before, and it has been widely reported, our problem here in Broward County is simply the supply of vaccine. Let me go over some numbers. As of January 28th, today, well, today's the 29th, but as of the numbers as of yesterday, the 28th, the positivity rate in Broward County was over 13.5%. The 3-day rolling average was 9.3%. The total number of cases has trended downward since the spike that we had for Christmas and New Year's. We did, in fact, have a spike for Christmas and New Year's. The numbers have been trending down, but they've been trending down to an average that is higher than it was before Christmas and New Year's. The numbers to be considered relatively safe are 5%. It has been a very long time since Broward has seen 5%. The numbers that we have are, again, as I said, have just recently started heading up. I suspect that this is just a short-term spike, and they will go back to the 7.5% that Broward has generally been in recently. However, every indication that we have is that the numbers are going to go back up. We're looking at probably February, March, April. With all of the new variants that are coming here, they are generally more infectious, sometimes easier to catch. Sometimes they appear to be deadlier. All of the studies have not yet been concluded, but we know that we have hard times ahead. As of January 28th, as of yesterday, Broward County had vaccinated 111,653 people with the first dose. 24,468 people have received both doses, for a total of 136,121 people that have been vaccinated. Let me explain Broward's vaccine problem. The state of Florida, for the past at least 3 or 4 weeks, I think longer, has been receiving 226,000 doses of vaccine each week. They arrive in Tallahassee on a Thursday. They are only notified a few days in advance how many doses of vaccine they will be getting for that week. President Biden, we're hoping for at least some relief. President Biden has indicated that by next week, I believe it is, we will be receiving a 16% increase on the amount of vaccines. And in addition to that, they have committed that instead of letting people know a couple of days in advance, less than a week, they'll be giving people 3 weeks notice. That is crucially important so people can plan. And I need to clarify my numbers. When I said 17,500 doses a week, or I may not have said that yet, the state of Florida is receiving, as I said, 226,000. The way that's divided is initially the state takes a percentage off the top. So with that percentage off the top, they provide vaccines to hospitals, to nursing homes, to the groups that are vaccinating the ALFs and other long-term care facilities. They are also certain strike forces. So for example, the state, as you know, put in task force to do Century Village, Deerfield, Century Village, Pembroke Pines, Winmore, and Kings Point, and those 4 did not count against the county's allocation. Those come off the top to the state. State has also done some individual programs I know they did Holocaust survivors. I know that they have done or about to do World War II veterans. I know that next week they're supposed to be in Broward County doing several locations specifically designed or targeted at least for a black population. Those locations have not yet been finalized. And those all come off the top. From the remaining number, Broward gets 17,500 doses per week. Those 17,500 are for first-time vaccinations only. We also get second shots, but I'm not counting that. I'm only saying that we get 17,500 per week towards first-time vaccinations. If you do, those 17,500, 4,500 go to Lockhart Stadium for the facility, which is jointly run by Broward Health and by the city of Fort Lauderdale. 13,500 are distributed by the state of Florida Department of Health in Broward County at Broward County Parks. The park locations are Tradewinds Park in Coconut Creek, Markham Park in Sunrise, Central Broward Regional Park in Lauderhill, Vista View Park in Davie, Coral Square Mall in Coral Springs. Additionally, I believe Fort Lauderdale is doing Snyder Park. I hope that the problem here is evident, that there are 340,000 seniors in Broward County. There are 2 million people in Broward County. If we're getting 17,500 doses a week, it will simply take way too long to vaccinate everybody. So we are hoping and counting on an increase. Again, the 16% increase that the Biden administration has promised is certainly welcome. It's also certainly not enough. Broward County can provide 50 to 60,000 doses currently, and that does not include the cities that we would like to partner with. Let me emphasize, we would very much like to partner with the cities. We don't have enough vaccines to give them. Several cities on the mayor's call that just concluded were saying, we want to do more of this. We need more vaccines. Please, we want to set up city pods. And my answer to them is, we only, after Snyder Park, there's only 13,500 doses. We simply don't have enough to give to the cities now. We have asked the cities to prepare so that when we do get more doses, we can immediately start working with our municipal partners. I'm sure everyone has heard that, I believe it was today, that the Johnson & Johnson vaccine, I believe they received their approval. I know they saw their numbers. If not, it will be next week. There are some issues with the Johnson & Johnson and some benefit. The Moderna and the Pfizer vaccine are both the mRNA, which are the modified RNA. So doing that, these vaccines have 95% effectiveness. However, they're also very perishable. The Pfizer vaccine in particular needs to be kept in an ultra deep freeze, while the Moderna vaccine can be kept in normal commercial freezers. The Johnson & Johnson vaccine is much more shelf stable. It's based on the older weakened vaccine model. When the Operation Warp Speed opened, they were looking for vaccines with a 60% or higher effectiveness. This has the Johnson & Johnson had either 65 or 66% effectiveness, and that would have been hailed as a great victory, except people see it today and compare it to the Moderna and Pfizer, which are 95%. Must be noted, however, that the Johnson & Johnson vaccine has an 85% record at preventing hospitalization or death. So 85% is pretty good, and in fact, you would have been happy with 66 at the beginning when flu vaccines typically are 55% effective. The Johnson & Johnson vaccine is a single-shot vaccine. Because it is a single-shot vaccine, it should be more helpful in getting into people's arms, because we are expecting, and preliminary data is showing, that some people that have received the first shot have not come back for the second shot when they're supposed to. Let me discuss what the county is doing to help our homebound population. Beginning next week, and I believe the calls are starting today, the county has a paratransit system, the TOPS program. There are approximately 3,200 people on that program that are over the age of 65. Under the governor's order, you must be over 65 to be eligible, unless a hospital determines that you have these certain significant pre-existing conditions. To the extent that people are on the TOPS program, they are being contacted, only the ones over 65, and told that the county will pick them up and take them to a location. Now, instead of having to wait online, as I think you know, all of the county's locations are only open 5 days a week. There is always a location open whatever day you go, because we have multiple locations, and one of them or more is open every day of the week, but each one is only open 5 days. What we intend to do with the TOPS program is take people that are already signed up and that are over 65. We will divide the county into 4 quadrants. We will take them to a location that is closed for vaccine except for the TOPS program. I must emphasize here, this is only for people that are already on the county's paratransit program. Don't go rushing to sign up for it, thinking that that way that'll get you immediately to a vaccine. It is only open to the people that are already on the county's paratransit program. Once the county has completed that county paratransit program, we will provide the same type of service to the people on the county's special needs list. And once we have completed that list, we will go to the vulnerable population list. Again, special needs, vulnerable population, only over the age of 65, and only to the people that are already on this. Now, the vulnerable population list includes both the counties and the cities lists. But I need to emphasize, again, do not try and sign up for it now. It's frozen in time for those people that have already said that they need help. Again, this will also take some time to do, because I think I mentioned, we don't have enough vaccine. That vaccine for these people is going to have to come from the county 17,500. I will work with the Department of Emergency Management to try and get that as a special off the top of the state program. But there's certainly no guarantees. And right now, we think that all we're getting is the 17,500. Let me move on to unrelated, I believe I've already discussed the cities. As to, we want to work with the cities, we will work with the cities, but we need vaccine. Let me move on to a completely different topic, which is golf courses, because I have received many emails recently about golf courses. Some have been complaining that people have been driving next to each other 2 per cart. Some people have been complaining that they are being told that the county is mandated that everybody pairs up 2 per cart. And some people have said that if you want to drive alone in your own cart, that there's a special fee. The county, either yesterday or today, has sent a letter to all golf courses reminding people that the emergency orders say that, yes, you can have 2 people in a golf cart. It's outside, it's generally moving, which are all good, but if they are not living in the same household, they must wear a mask while they're in the golf cart together. And no, the county has not mandated that there be 2 people in a cart or said that there's any surcharge. These are just programs that each individual golf course may have set up. What the county has said is we are permitting but not mandating 2 per cart. But if you are in a cart, 2 people together, you must either live in the same household or you must be wearing masks. Let me discuss an eviction mediation program, which has come up. Starting on approximately February 16th, and the county and the court system are still working out the details on this. We are expecting the chief judge to refer all eviction cases to mediation. At mediation, the person that is being evicted will have to show that the reason that they have not been able to pay their rent is because they or their family member lost a job, their hours were severely cut back, their pay was cut in half, something, just to make sure that the system is not being gamed and that people that have continued to have a job or 2 or whatever the family situation was prior to COVID, if they still have that, then they're not eligible for this program. And this program is only to help people affected by COVID. Once they show that, the county will agree to pay 75% of the outstanding rent for the most recent 4 months to the landlord, or 60% for everything beyond that, up to a period of 1 year. Remember, this crisis started around March. In the event that the landlord is willing to accept that amount, and in the event that the landlord is willing to keep the tenant on, because, again, in many cases, their leases would have expired, then the county will agree to pay that arrearage. It is better in the long run for the landlord to get 60% of 5 months and 75% of 4 months. That's an arbitrary number I'm using as an example. And take that and let the tenant stay and expect the tenant to stay current in the future, as opposed to evicting the tenant. And if the tenant is going to be evicted, typically the landlord would get little to nothing of what they're owed. So we are still finalizing the details on this program. As I said, there would have to be an agreement between the landlord and the tenant on that. Let me deal with the food insecurity issue, which is a major issue in Broward County. There's a food insecurity issue. We don't have enough food out there. The lines, I think you all have covered, that the lines have been very long. The county has spent $17 million thus far during the pandemic on helping food programs, with that bulk of that money going to Feeding South Florida, or the Area Agency on Aging, with some going to the school board to help provide meals, particularly when the schools are closed. I have some additional numbers in case there's questions, but I don't think there are, on the statistics for where Broward is. And I believe at this time, I'm happy to answer any questions, and I'm sure there are some. Sir? Okay, the question was, how are we preparing for spring break with the crowds expected, and is the governor doing anything to help us? Answer first with the governor. I haven't spoken with the governor since I became mayor. So you can make any judgment you want on that. I have spoken with the governor's chief of staff. The issue specifically of spring break has not come up, but every time that I have requested a mandatory mask order, I've been turned down, so I have no reason to believe that that's going to change in the near future. We are hoping that we are not going to see your normal spring break crowd because, it's difficult to fly. A lot of people still are not flying. We are hoping that we will not see our typical spring break crowd. Now, to the extent that there is a spring break crowd, I intend to work closely with the city of Fort Lauderdale, with the Fort Lauderdale, with Broward County Convention and Visitors Bureau, with Fort Lauderdale bars and restaurants, and stressing that the county will be vigorously enforcing its mask order. I want to point something out. Do you know what I have underneath my mask? Another mask. I'm wearing surgical masks, and I'm wearing 2 of them because it's important that for all of us to protect ourselves, protect ourselves, others, and our community. And you can do that by wearing a mask. And I intend to work with the county to ensure that we are vigorously enforcing this, that we are aggressively fining bars and restaurants, particularly during spring break. And if we have to close down 1 or 2 to keep them from doing this and make an example for the others. I do not want to shut down a single business in Broward County because of COVID. But if we're going to avoid shutting them down, then they need to comply with our orders on masks and social distancing. And if they're not complying with our orders on masks and social distancing, whether they realize it or not, they're killing people or hospitalizing them. The average age of infection for people in Broward County is 39. It's not 65. It's not just an old person's disease. The average age is 39. So that means there's a whole bunch of people in their 20s and 30s that are getting it. So what are we going to do during spring break? We're not encouraging people to come. We can't keep them off our beaches, but I can promise them that if they come, they stay out in the open, on the beach, on the breeze. They're 6 feet away from each other. God bless them. We're not going to do a thing to them. If they go to bars and restaurants, and the bars and restaurants comply with the rules that we have, God bless them, we're not going to do a thing. But if they're violating our emergency orders, if the restaurants and bars are violating our emergency orders, we will not tolerate that. And I intend to work, as I said, with the city of Fort Lauderdale, the bars and restaurants, to make sure that they understand that. Next question.
With regards to your mayor's call today, what do you think was the biggest takeaway from the concerns of all the cities?
The cities rightfully want vaccine. I have told the cities that we are willing to work with them, more than willing, we want to work with them. They and us represent the same constituents, except for the Broward Municipal Services District, which is just over 1% of our population. Almost everybody, actually everybody except for that 1% or so, I guess, and the Indian reservation. Everybody else is in both the city and the county. So the cities represent them, the county represents them, they're the same people. We want to work with the cities. In fact, it would be easier for the county. Right now, the county is looking at having to expend between $50 and $100 million on providing the locations and all of the other ancillary services for the next 6 months. We're looking at between $50 and $100 million. We don't have that kind of money. We'll find it, because the first priority of government is to protect its people. So we will find that money, we'll do whatever we can, but we don't have enough vaccines. The cities want us to give them some so they can set up in their municipalities. I'd love to do that. That would lessen the strain on the county if we have the cities doing these things, if we have the cities putting shots into arms. But we don't have the vaccine. I think I may have mentioned, we need more vaccine. We must have more vaccine in Florida, and then ensure that Broward County gets its fair share. Yes, ma'am. No, that includes running the vaccination sites. Yeah, it's a lot of money. Yes, so the 50 to 100 million, we're not including the amount we're giving to, I mentioned 17 million that we've given to school board, area agency and aging, and Feeding South Florida. That's not included. The money that we're going right now to be giving for mediation to prevent evictions, that's not included. We're talking about 50 to 100 million just to run our vaccination program. It's expensive. The county doesn't have the money, but we will find a way to get the vaccines into the arms if we have the vaccines.
And that, sorry, just to clarify, that 16% increase that
Yep.
you were talking about, any idea like when you're expecting that?
I don't know specifically, based on the call with Dr. Thatchy, based on what I've asked my staff to research. It appears that it's supposed to be coming in 2 weeks, but unfortunately, we could not locate really specific information. Dr. Thatchy said she was expecting it soon. So we think it'll be in the next about 2 weeks, give or take a week.
And 16% more than what we've been getting.
Yes, sir. So the state of Florida has been getting 226,000 doses. I have my little calculator here. I'm expecting that they will get 226 times 1.16. They should be getting 262,000 doses instead of 226. And I'm hoping that Broward County will get its increase, which I haven't calculated, but should be somewhere around 19,000 instead of 17,500, between 19 and 20,000. Actually, I think about it's probably closer to 20. Actually. Well, by the way, first, I've run the numbers. Broward County should be getting 20.3 if our 17 19,500 increases by 1.16. We should be getting 20,300. Your question was, am I disappointed? Yes, but I'm disappointed but not surprised. I hope everybody remembers the stockpile of vaccines that was supposed to be released under the last days of the Trump administration. And then we found out that there was no stockpile. And many governors were very angry over that. And we've recently found out that there weren't enough vaccines ordered. Despite that, I'll tell you again, Operation Warp Speed, I believe that the Moderna vaccine was part of that. The Pfizer vaccine was not. But certainly, I think that Johnson & Johnson, and we're expecting one or two other at the AstraZeneca vaccine, we're expecting these should be coming on board fairly soon. Johnson & Johnson is the first one we'll see. I am very disappointed that we don't have more vaccines. I blame the governor for a lot of things, primarily that he is not letting us in Broward make our own local decisions on masks. However, I do not blame the governor for the amount of vaccines we're getting. I think that we in Broward now have the infrastructure set up. I think in many counties, they have the infrastructure set up. I think the state has the infrastructure set up to deliver a multiple of the doses that we're getting. I am absolutely confident that the state of Florida alone, which has been getting 226,000, could distribute 1 million doses a week instead of the 226,000 we've been getting. But we don't have the vaccine. I can tell you Broward County has been getting 17,500, and we could on one shift do 50 to 60 plus outboard some to the cities. And if we had enough vaccine, we would consider going to 2 shifts, which would, could deliver 100 to 120,000 doses a week plus the cities. We have a small fraction of the amount of doses that we need. While I was discussing the state system, let me add one thing. The phone system that they had was confusing. And it's my understanding that they've changed the message on it several times. And I spoke with the governor's chief of staff about this, and he told me he would make the change. The way that it was working was when people were calling in, they would key in their information, and then they'd hang up, and they were told they'd get a call back to schedule their appointment. And people were getting upset that days were going by, and they hadn't received a call back. The way that it was working was you would only get a call back when your name came up on the list. So if Broward County had 17,500 vaccines and you were number 60,120, you wouldn't be getting a call back for 3 or 4 weeks. So nobody was telling them that. They were just told you will get a call back when it's your turn, but nobody understood that they were not going to be called back until it was their turn. I have not listened to that call. The governor's chief of staff personally told me he would change it. I've noticed that today they have come up with a system where they can log in online. I think that will be more efficient. I hope that will lessen frustration. But, again, the state is running that system. I've said this several times before. When people are calling me and say, I need this vaccine here, I need the vaccine there, Broward County does not control 1 dose of vaccine, not one. All vaccines in the state of Florida are being distributed by the state of Florida, or in the case of some of the long-term care facilities, by companies that are contracting with the state of Florida. None of them are going through Broward County. directly. Are there any additional questions? Are there any additional questions? Going, gone. Thank you for coming.